Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Pravastatin, also known as Pravachol. So what is Pravastatin and how does it work? Pravastatin is a prescription medication that belongs to a group of medications called statins. So if you're diagnosed with high cholesterol, your healthcare provider will typically recommend changes to diet and exercise first. If that doesn't work, then statins are your first line of defense. Pravastatin, like other statins, works to reduce cholesterol by lowering the amount of cholesterol your body makes by blocking an enzyme in your liver called HMG-CoA reductase. Pravastatin is considered a low to moderate intensity statin, depending on the dose you take. Pravastatin is available in 10, 20, 40, and 80 milligram tablets. However, only patients not reaching their LDL-C goal with 40 milligrams should take 80 milligrams. Pravastatin doses are based on age and are lower in children and teenagers. People taking this medicine during childhood or adolescence may need a different dose as adults. If you have high cholesterol, why is it important to take Pravastatin? It's important because over time, bad cholesterol can accumulate on the sides of your blood vessels and decrease blood flow for certain organs, like your brain and heart. This buildup is commonly referred to as plaques, and when these plaques rupture, this can create a medical emergency known as a heart attack or stroke. So, by lowering your cholesterol, Pravastatin helps to reduce the buildup of plaques, which reduces a person's risk of developing a heart attack or stroke. This is particularly important for people who have multiple risk factors for heart disease. When is the best time to take Pravastatin? Pravastatin can be taken once daily, with or without a meal. Pravastatin is usually prescribed to be taken in the evening. It has been shown that Pravastatin is more effective when taken in the evening rather than in the morning. It's also recommended that you try to take the medication at the same time each day, as it's much easier to remember to take it that way. Keep in mind that there are other statins, such as Zipidamag, that can be taken at any time of the day because it has a longer half-life, which essentially means it lasts longer in your body. What if I miss a dose? If you do forget to take a dose, take it as soon as you remember, unless it's almost time for your next dose. In this case, skip the forgotten dose and take the next one at the usual time. Do not take 2 doses together to make up for a missed dose. What are the side effects of Pravastatin? Like all medications, Pravastatin has a few side effects. Some common side effects include headache, dizziness, cold-like symptoms including a sore throat, trouble sleeping or insomnia, nausea, heartburn, stomach pain, indigestion, constipation, and muscle pain including joint pain. So if you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Does Pravastatin interact with other medications? Yes, it can. Always talk with your healthcare provider and tell them about all medications, supplements, or vitamins you may be taking. Importantly, Pravastatin has less potential for interacting with other medications compared to other statins. This is because of the way our bodies process it. Most statins are processed by the cytochrome P450 family of enzymes. This is the same enzyme family that is used by 70 to 80% of other drugs. Pravastatin is not processed this way, and because of this, Pravastatin is a good statin choice for patients who are currently taking numerous medications. Some medications that Pravastatin can interact with include cyclosporin, erythromycin, clarithromycin, gemfibrozole, and medications that contain niacin, including niaspan, which can lead to increased statin levels in your blood and can then increase your risk of adverse effects. It's also recommended to take Pravastatin either 1 hour before or 4 hours after taking cholestyramine or cholestyramine if you're taking either of these medications. So what should I avoid while taking Pravastatin? Although grapefruit and grapefruit juice should be avoided with most statins because it can increase your risk of side effects, this is not a concern with Pravastatin. So with Pravastatin, there is no limitation on grapefruit juice or products. Avoid consuming food that's rich in cholesterol or fat. If you don't adhere to a diet that lowers cholesterol, Pravastatin won't be as successful in lowering your cholesterol. Lastly, avoid taking Pravastatin with alcohol. as it may increase your risk of liver damage and your triglyceride levels may rise as a result. So like all medications, you should speak to your pharmacist or your healthcare provider about any questions that you have. There's a lot of information on high blood pressure, cholesterol, and other cardiovascular treatments on our website. Check out our blogs in the links below. Bye for now!